I'm going to take us through how Radiesse works and how it differs from a dermal filler and Botox. So as we age, we have massive changes in our face, whether that's to do with the actual fat pads that lie within our face. So we have superficial fat pads and we also have deep fat pads. And then we also have ligaments, muscles, and our bones. So first, let's start at the bones. The bone reabsorbs as we get older. So a lot of older women will notice through their jawline here, they get the reabsorption and then they get the formation of the jowl. The fat pads as well through here diminished, and then we get the hollowing, and then we get the nasolabial fold that falls forward. So what I like to do is attack it by re-establishing structure underneath the skin and also creating a biostimulating type activation in the skin. So what we can do as an injectors is we can actually just put volume back into the areas that has lost the volume, but we're not actually doing anything about changing the structure and actually the impact of what there is happening with the structural loss. So there's a product called Radiesse, and I love to use Radiesse. So we usually use it as a foundational treatment. So it's an injectable product, and we like to put in like 1 to 2, 3, depending how much your budget is per year. Now the way the product works is it is a biostimulator, so it stretches the fibroblast and then it actually creates lots of collagen and elastane, providing volume but also structuring under the skin. So if you imagine, instead of renting your house like you would with a dermal filler or maybe a skin booster, the Radiesse is actually providing structure, so you're pretty much like investing in buying the house. So what we can see here is I've got, this is a demonstration of sort of what a normal young face would look like. This would be in the sort of early 30s, and then this starts to change once we hit about 34, 35, and the fat pads through here will change, and also the structure of the muscle and the bone underneath. So what we will see then as we age, you can see this lady here, she has got a loosening through here, which is one of the main retaining ligaments that run through our face. Her fat pads have completely changed in size. So that's when we're getting this flatness, it goes hollow, and then everything's just pretty much falling down and forward. So what I like to do with we would probably do dermal filler on this sort of fat pad as well, but to start off the process, that stimulation, remember this product is made of calcium hydroxide apatite. So this is similar to our bone, and if you had an x-ray taken of your face after the product had been put in, you would see it almost up to a year of it being put in. So if you imagine, it's not just going to go away, and that's what I love about this product is it continues to stimulate. And we all know as we move into that perimenopausal period, we're going to lose about 30% of our collagen over that time by the time we actually become menopausal. So we kind of want to do that collagen banking, or if we're going through that transition, we want to actually build up the collagen stores, so we're not going to have such a huge impact as we go through those hormonal changes. So what I'm going to do is I'm going to show you on my face the parts of the face that we'd like to put this product. There's different ways to do it, but if we're going for that more lifting biostimulation in the back area of the face, then we're going to treat actually that lateral portion. So over here, what I'm going to do, so what we're going to do is we're looking at the lateral part of the face. So if I draw sort of like a bit of a line down here, you'll see this is what we talk about when we talk about lateral. So there is a big ligament that runs down this part of our face, and if you imagine when we lose the volume through here, which we get a lot of sinking through this part here and also through the jawline itself, that's when we get that like kind of hollowing, and you can imagine as the fat pads fall forward, they're going to drop down. So what I like to do is I actually like to blend the Radiesse product all through this part of the face. And another big area that we also lose a lot of volume is through the temple here. So we like to blend it through here and a tiny bit up into the hairline as well. And if you imagine over that year that I was talking about, that the product is stretching the fibroblast and continuing to do that stimulation, we're going to get a bit of tightening through here, and we're going to build that collagen, but we also get a bit of volume from the product, which I really like. There is other tips and tricks that we can do with the product. We can put it undiluted as well down onto the zygoma, onto the gonial angle, and we can put it actually into this frontal portion of the face as well to support that area, which is just going to give that kind of like structuring as such. So that is the when we talk about the Radiesse treatments, and I know it can get quite confusing because it is advertised as a dermal filler, which you can use it. The thing is it's not dissolvable, so I really like to use it as that biostimulator or that more structural like type product that we're doing the groundwork, and then we'd come back in and then we'd be putting the volume into, say, the fat pads that we've lost, whereas you'd use a bit of cheek filler. That's a really good place, and also putting some filler back into this lateral part. But if you prefer a product like Radiesse, which is low inflammatory, you might choose to actually use more Radiesse product to actually build and revitalize the face. The last point I want to make about this product, it is super natural, so we're not transforming the face and changing the structure as such. We're just trying to give back the volume loss that has occurred as we age.